and welcome back to another episode of Inside Oversight, an official podcast of the Veteran Affairs Office of Inspector General. This is your host, Adam Roy. Today, I'm speaking with Erica Taylor, a health systems specialist within the Office of Healthcare Inspections here at the VA OIG. We're going to be discussing the report, Inadequate Coordination of Care for a Patient at the West Palm Beach VA Healthcare System in Florida, which we published back in March of 2023. Welcome, Erica. How are you doing today?
I'm great, thank you. I'm excited to be here talking with you.
Excellent. So let's get started. If you could just briefly tell us the focus of this report.
Sure, Adam. The OIG received allegations that a primary care provider and a pulmonologist failed to monitor a patient's cancer after they completed radiation treatment. That led to the progression of the patient's cancer. The complainant alleged that these failures ultimately led to the patient's death. In evaluating the allegations, the OIG did not substantiate a failure to monitor the cancer by the primary care provider or pulmonologist, but did find failures related to communication of test results to patients and the use of return to clinic orders. In addition, the OIG found a failure with coordination of care between the VA and community care providers. To understand many of the issues described in this report, I would like to provide some context about challenges the OIG has found with coordination of community care services more broadly.
That's a good starting point. I appreciate that. Let's start by telling our listeners what you mean by community care and why coordinating this care is so challenging.
Yes, of course. Very generally, the VA has a program called Community Care, where the VA purchases medical care from medical providers outside the VA healthcare system when the VA cannot provide the needed medical service. When this care is purchased, the VA administrative staff and the VA provider ordering the community care are required to continue involvement and coordination of the care for the patient. This can include things like requesting medical records, scanning them into the VA electronic medical record, and reviewing and acting on any recommendations from the community providers. The recommendations from community providers can include things like follow-up imaging and laboratory tests, prescriptions for medications, requesting additional visits with the patient, and consultation with medical specialists.
Perfect. And the topic of community care is something of interest for the VA OIG. Prior to this report, can you kind of talk overall the VA OIG's focus in regards to community of care?
Sure. Over the years, the OIG has published many reports detailing issues related to appointment scheduling with community providers and delays in VA getting clinical information back from community providers. There have been several prior reports that highlight failures in coordinating community care for services. For example, a report issued in February of 2022 discussed failures in consult management scheduling that led to delays in cardiology care for a patient at the Martinsburg VA. In this case, a patient waited 124 days to have follow-up cardiology services in the community coordinated. During the intervening time, the patient was hospitalized for chest pain. In another report issued July 8, 2021, the community care staff at the New Mexico VA healthcare system were not correctly processing returned medical records from the community care providers, which resulted in the VA providers not having ready access to the information they needed to coordinate follow-up care for patients.
Okay, so some history of challenges by the VA. So in this situation, what happened at the West Palm Beach VA specifically?
This report looked at coordination of a patient's care and the monitoring of a patient's cancer following treatment. One aspect I'd like to focus on involved the coordination of care between the VA and a community care chiropractor.
And how does coordination of chiropractic care impact monitoring of someone, a patient with cancer?
I'm so glad you asked. In early 2018, the patient was diagnosed with a rare lung cancer. The tumor was treated with radiation, which shrunk the tumor, but it didn't eliminate it. The patient required ongoing monitoring of the tumor after the treatment was completed. During the monitoring or the surveillance phase of the patient's care, the patient experienced pain in their back and their buttocks. The patient communicated to the primary care provider about their pain. To assess the cause of the pain, the primary care provider referred the patient for x-rays and to several specialists, including a VA chiropractor. The VA chiropractor completed an initial evaluation of the patient's pain, but then due to some scheduling limitations, referred the patient to a community chiropractor for further evaluation and treatment. The community chiropractor assessed the patient and recommended an MRI of the low back in late summer of 2018. The community chiropractor's notes were returned to the VA and scanned into the patient's VA medical record in the fall. Because the VA chiropractor referred this patient to the community, the records from the community chiropractor were sent to the VA chiropractor, not the patient's primary care provider. We know that the VA chiropractor received the records, but for unknown reasons, the recommended MRI was never ordered.
And a follow-up question here. Would the MRI of the low back have detected lung cancer?
That's a great question. Unfortunately, the patient continued to have pain, and then in late July of 2019, the day the patient was scheduled to have a routine image completed to monitor their lung tumor, they went to the emergency room due to their pain. The imaging of the lungs was completed that day, and medical providers found that the tumor had grown significantly. The patient was admitted to the hospital from the emergency room to control the pain and continue the evaluation of the lung tumor. An MRI was done during the patient's hospitalization, and multiple lesions and fractures were found in the lumbar spine. These fractures were characterized as likely related to the patient's lung cancer.
So to quickly summarize, the MRI the community chiropractor had recommended was not completed, and then when an MRI was completed, fractures that may be related to cancer were found in the patient.
Yes, you're correct.
Okay, so that's a good history of what occurred. So now walk us through what should have happened in this situation.
So we would have expected to find documentation that the community chiropractor's recommendations for an MRI were reviewed to include any clinical reasoning for ordering or not ordering the recommended MRI. While we definitely cannot say that an earlier MRI would have changed the prognosis or the outcome, there may have been a missed opportunity for an earlier diagnosis. For patients, even with a terminal disease, earlier diagnosis offers opportunities for other types of support. Some examples are appropriate pain control, education and referral to hospice care, and family and caregiver support. These are really meaningful interventions that all patients deserve.
That's an absolutely valid point. Certainly meaningful. What recommendations in the report were made regarding this finding or the overall findings?
Sure. The recommendations are pretty simple. We recommended that chiropractic providers review community care notes and take action as needed. The rules were in place and they just weren't followed. These activities of care coordination are really so critical. And this case highlights what happens when community care is not a seamless and coordinated process for a veteran. VA relies on the participation of community care providers to meet the clinical needs of veterans, but we're finding more and more gaps in this process. OIG will continue to look closely at VA community care and provide recommendations that will support improvement.
Absolutely. The VA-OIG certainly will do that. And I thank you for your time today, Erica. Is there anything else you want to add before we wrap up?
There's not. Thank you for having me.
Erica, thank you so much for your time today. I encourage those listening to visit the VA-OIG's website and read the full report there. Again, that report, Inadequate Coordination of Care for a Patient at the West Palm Beach VA Healthcare System in Florida, and that was published in March of 2023. That's it for this episode of Inside Oversight. I encourage you to listen to more episodes wherever you listen to podcasts. Also, check out Veteran Oversight Now, our sister podcast where we cover oversight topics in greater detail. Thanks for tuning in.
This has been an official podcast of the VA Office of Inspector General. Inside Oversight is produced by the Office of Communications and Public Affairs and is available at va.gov/OIG. Please subscribe and tune in monthly to hear how our work is helping to improve the lives of veterans. Visit the website to learn more about how the VA-OIG conducts meaningful independent oversight. Report potential crimes related to VA, waste or mismanagement, potential violations of laws, rules, or regulations, or risks to patients, employees, or property to the OIG online or call the hotline at 1-800-488-8244. If you are a veteran in crisis or concerned about one, call the Veterans Crisis Line at 1-800-273-8255. Press 1 and speak with a qualified responder now.